Heart attacks in women look differently than in men, and the warning signs can be very different too. If I asked you right now to close your eyes and picture someone having a heart attack, you'd probably see an older man, a bit overweight, clutching his chest, going down on one knee. That picture lives in all of us because it's in the movies, it's in the ads, it's in the back of our minds. And for a woman, it's one of the deadliest pictures you can have because every time you see it, reinforces the idea that heart attacks happen only to men. Heart disease is the biggest killer in the world, and women are nowhere near as safe from it as they have been led to believe. Most never see it coming because they spent their whole lives being told in 100 small ways that their heart isn't the thing to worry about. I have been a cardiologist for over 20 years, and some of the patients who haunt me the longest are the women who were certain right up to the day it happened that this would never be their problem. So today I want to talk about why heart disease gets missed in women so often, what it can actually look like when it isn't the dramatic version from the movies, and the one thing I want every woman watching to go and do. So stay with me because Mary's story will stick with you for sure. So let me start with how big this really is because the numbers surprise people. When I send patients for a scan that looks at the arteries around the heart, I can see plaque. That's the fatty buildup that eventually causes a heart attack in a huge number of those scans. In around 6 out of 10 men and in 4 of 10 women. These are often women who feel completely well. No symptoms, no warning, just getting on with their lives. The buildup is already going on there, doing its work, years before anyone would think to look for it. And here's what makes it harder for women. There's a belief that I hear all the time, sometimes from the woman herself, sometimes from the people around her, that heart trouble runs in the men of the family. The men have to mind themselves, the women will be grand. It's just not how the heart works. The second reason it gets missed is one I see in clinic almost every single day, and it's worth saying this out loud. Women, in my experience, are extraordinary at looking after other people. I watched it constantly. A woman will look after the children brilliantly. She will look after her parents, often even better. She'll make sure her husband gets his checkup, books the appointment, nags him until he goes. You look after everyone but yourselves. And so when the woman's mammogram gets pushed back, the smear gets left for another year, the funny turn gets explained away because there's a child to collect, a deadline at work, a house full of people who need her, the one name that never makes it onto the list is her own. The third reason is that when something does start to go wrong, it doesn't always look the way the films taught you it would. It isn't the big chest clutch. If you remember one thing from this video, let it be this. The signs of a heart attack can be tiredness that just don't go away, or a breathlessness on the stairs that you used to take 2 at a time. It might be a tummy ache, an ache that goes into the jaw, the back, that you might put down to indigestion. And because it's vague, and because you're busy, and because everyone is so used to you coping, it gets blamed on stress. The stress, the hormones, menopause, the time of life. Sometimes you even blame yourself. Sometimes, and I'm sorry to say this, it's a doctor who did not take the time to look properly. So let me tell you about Mary. I've changed her name, but everything else is exactly as it happened. Mary was 41, a mother of 2 children with a demanding academic job. The kind of woman who fits in a bit of exercise, eats well enough when there's time, and there's never quite enough time. She came to see me for a heart check before starting HRT, which was exactly the sort of sensible, responsible thing she did for everyone, including for once herself. I looked at her and I didn't like what I saw, so I recommended a cardiac CT scan and some changes around her diet, her movement, and the stress that she was carrying. And then Mary did the most human thing in the world. She had a family holiday coming up, life was busy. She put it off for one holiday. Mary had a heart attack on that holiday. At 41, she survived it, thank God. She's done very well since she returned and did our cardiac rehab program. She's joined my reset program and she's back at work. But she'll tell you herself she's more frightened now than she was ever been. And the scan that might have warned her was sitting there booked, waiting, while she did what every woman does and puts herself to the back of the queue. So here's what I ask of you. If you're a woman watching this, or if you love one, stop treating your heart as the one thing you don't have to think about. If there is any history of heart trouble in your family on either side, the women included, if you're going through the menopause, if you are carrying stress, tiredness for a long stretch, any of those is a reason to get your heart looked at properly. Not just the standard blood, your actual heart risk. Book the scan. Don't put it off. not after the holiday, not after the school year, not when things finally calm down, because for a woman like you, things will never quiet or calm down. Make that appointment the way you'd make it for your own child, with exactly the same seriousness, because you'd never let them put it off. For a long time, medicine treated heart disease as a man's illness, and a lot of women have paid the price for that. You don't have to be the one of those men or one of those people. You spent years making sure everything around you is looked after. You're worth the same care you give everyone else. And if you've ever been told your results came back normal and felt reassured by that, watch this one next before you do anything else. I explain why a normal cholesterol result can still fit inside a heart that's heading for trouble. It's on the screen now.